Welcome to Incentives Matter, your guide to what's new in behavioral science and behavioral economics. Let's see what's really driving decisions.
Imagine a scenario where a government agency says it's implementing a nudge to improve public health, but what they're actually doing is making it incredibly difficult to opt out of a program. Is that still a nudge?
That's precisely the kind of linguistic slipperiness the World Health Organization is now trying to police. The behavioral science field, for all its innovations, has become a bit of a Wild West when it comes to terminology.
So the WHO is stepping in to be the arbiter of behavioral science buzzwords? That feels like a significant move for an organization focused on global health.
It is. The stakes are much higher than just academic precision. When these terms are used interchangeably, or worse, misused, it has real implications for public health policy, the integrity of the research, and ultimately, public trust.
It sounds like the problem stems from behavioral science terms becoming almost too popular, moving from academic papers into the broader public and policy discourse, and losing their original meaning along the way.
Exactly. Terms like nudge have become ubiquitous. They're thrown around in policy memos, marketing strategies, and even casual conversation without a consistent understanding of what they actually entail. This semantic ambiguity makes it incredibly difficult to evaluate interventions, compare studies, or even communicate effectively about what's being done. It's like trying to build a complex machine when everyone has a different name for the same tool.
So a buzzword bingo situation, but with serious consequences. What specific terms are they focusing on? Because nudge is probably the most famous, but it's not the only one.
The WHO, in collaboration with organizations like the CDC and the UK Cabinet Office, is primarily trying to delineate three key types of behavioral interventions: nudges, boosts, and sludges. They're also clarifying what isn't a behavioral intervention in this specific sense, like mandates or bans.
Okay, the first term to consider is the nudge, the one everyone thinks they know. How is the WHO defining it, and how does that compare to its original definition?
The WHO's definition largely aligns with the classic formulation by Thaler and Sunstein. A nudge, in this context, is an intervention that alters the choice architecture in a predictable way without forbidding any options or significantly changing economic incentives. The key is that it preserves freedom of choice. Think of it like rearranging the furniture in a room to make it more likely someone sits on the comfortable couch rather than the hard chair, but they can still choose the hard chair if they want.
So putting healthy food at eye level in a cafeteria, or making organ donation an opt-out default rather than opt-in, those are classic examples.
Precisely. They make a particular choice easier or more salient, steering behavior without coercion. The individual still retains full autonomy to make a different decision. The classic example in public health would be default enrollment in a vaccination reminder system, where you have to actively uncheck a box if you don't want reminders. It encourages uptake without forcing it.
And the advantage there is that it's often low-cost, scalable, and respects individual liberty. But if nudges are so well defined, where does the confusion come in?
The confusion often arises when interventions that do remove options or significantly change economic incentives are still labeled as nudges. A tax on sugary drinks, for example, alters the economic incentive quite dramatically. Or a mask mandate, which removes the option to go unmasked in certain public spaces. These are not nudges under the precise definition. They're more direct policy levers. Mislabeling them as nudges blurs the lines and can lead to a misunderstanding of their mechanisms and potential side effects.
That makes sense. It dilutes the concept. Now, what about boosts? That's a term heard less frequently. How do they fit into this taxonomy?
Boosts represent a distinct category. While nudges work by subtly altering the environment to guide behavior, boosts aim to enhance people's competence to make better decisions themselves. They focus on building skills, knowledge, and agency. Instead of moving the healthy food to eye level, a boost would be teaching someone why healthy eating is important, how to read nutritional labels, or how to cook healthy meals.
So it's about empowering the individual, giving them the tools for informed decision-making rather than just guiding their choices.
Exactly. Think of it like this. A nudge is a guardrail on a path, gently guiding you away from danger. A boost is giving you a map, a compass, and navigation skills so you can choose your own path and avoid danger yourself. In public health, a boost might involve media literacy training to help people identify misinformation about vaccines, or financial literacy programs to help individuals manage their healthcare costs more effectively. The focus is on long-term self-efficacy.
That's a really clear distinction, and it highlights a philosophical difference too. Nudges are more about automating good choices, while boosts are about educating for good choices.
Precisely. And this distinction is vital for policymakers. If the goal is long-term, sustained behavioral change rooted in understanding and autonomy, boosts might be more effective. If the goal is immediate, widespread adoption of a simple behavior, a nudge might be the go-to. Recognizing the difference allows for more targeted and effective intervention design.
Okay, so there are nudges, which subtly guide choices, and boosts, which empower individuals. The next category is sludges, and the name itself sounds unpleasant.
It is. Sludges are essentially the antithesis of a good behavioral intervention. Where nudges make desirable actions easier, sludges intentionally make choices harder, more burdensome, or more confusing. They're designed to deter certain behaviors, often for the benefit of the entity creating the sludge rather than the individual.
So think about those intentionally difficult cancellation processes for subscriptions, or complex forms with tiny print and hidden fees.
Those are perfect examples. In public health, a sludge might be a convoluted application process for a benefit program designed to ensure people don't get access to it, or an intentionally confusing website for scheduling a vaccine appointment, leading to high abandonment rates. The goal of a sludge is often to create friction and exploit cognitive biases to achieve a desired outcome for the system, not necessarily the user.
That sounds less like behavioral science and more like manipulation or even exploitation.
That's precisely why the WHO is emphasizing this distinction. Nudges are generally considered ethically neutral or even positive, especially when transparent. Boosts are almost universally seen as positive, empowering individuals. Sludges, however, raise significant ethical red flags. They often involve deceptive practices or exploit cognitive limitations to the detriment of the individual. Identifying and naming them helps call out these practices and prevent them from being nudge-washed, where a harmful sludge is rebranded as a benign nudge.
Nudge wash. That's a powerful term. So if someone implements a ridiculously complicated form to claim a health benefit, they can't just call it a nudge to encourage careful reading?
Not if the WHO's efforts are successful. The clear definition of a sludge helps expose the intent. It's about accountability. When governments or organizations claim to be using behavioral science for public good, they need to be transparent about how they're doing it. The new taxonomy provides a framework to scrutinize these claims.
Beyond the ethical concerns, what are the practical implications of this standardization for researchers and policymakers? For researchers, it's about improving the rigor and replicability of studies. If one research team is studying the impact of nudges on vaccination rates, and their definition of nudge includes mandates, while another team uses the classic definition, their findings aren't truly comparable. A common language allows for more accurate meta-analyses, better evidence synthesis, and more robust conclusions. It elevates the field from anecdotal observations to systematic science.
And for policymakers, because they're the ones actually implementing these interventions.
For policymakers, it provides a clearer menu of options and a better understanding of the expected outcomes. If they want to empower citizens, they know to look for boost-style interventions. If they want to gently guide behavior without restricting choice, they look for nudges. And crucially, it helps them identify and avoid sludges, which can erode public trust and lead to ineffective or even harmful policies. It's about designing more effective and ethical interventions from the outset.
It seems like this initiative is a sign that behavioral science is maturing as a field. It's moving past the initial excitement of novel findings into a phase of greater methodological and definitional discipline.
Absolutely. It's a necessary step for any scientific field that gains widespread attention. Initially, there's a burst of innovation and excitement with a proliferation of ideas and terms. Then comes the period of consolidation, where definitions are refined, methodology standardized, and ethical guidelines established. For behavioral science, which directly impacts human behavior and welfare, this maturation is critical. It moves beyond the cool factor to ensuring responsible and impactful application.
And the focus on public health context makes it even more urgent, given the global challenges faced from pandemics to climate change, where behavioral insights are increasingly leveraged.
Precisely. In areas like vaccine hesitancy, promoting healthy diets, or encouraging adherence to public health measures, the impact of well-designed, clearly understood interventions can be enormous. Conversely, poorly defined or ethically dubious interventions can undermine trust and set back public health efforts significantly.
So, to summarize, the WHO and its partners are pushing for a standardized vocabulary in behavioral science, primarily distinguishing between nudges, boosts, and sludges. Nudges subtly guide choices, boosts empower individuals through competence, and sludges intentionally make choices harder, often unethically.
That's a good synthesis. The goal is to bring clarity, improve replicability, guide ethical application, and ultimately build public trust in behavioral science interventions, especially in critical public health contexts.
And what this means for the public is that they might start hearing more precise language around these interventions, allowing for better scrutiny and understanding of the policies being implemented.
One can hope. It empowers everyone, from researchers to citizens, to ask more pointed questions about the mechanisms and intentions behind behavioral interventions.
So, as more of these behavioral insights get woven into policy, how might this new standard language change the way government or corporate initiatives that claim to be helping the public are evaluated?
That's all for this episode of Incentives Matter. Join us next time as we keep unpacking what really drives decisions. Thanks for listening. Choose wisely, or at least know why you didn't.